For years, I've been an employee here, and I have been on different committees over the years. But up until about a year and a half ago, it just seemed like nothing ever really got done. We'd work on issues, we'd get some plans formatted, and nothing got done. It seems in the last year to 2 years, the people who are now involved, we are finally seeing results.
We kind of laugh that I get excited about dumb things because I'm on the committees, but now we know that they're available and we can actually use them properly.
We've had some excellent results in helping our staff understand pain, understand the interventions that are available to them, improve the doctor-patient and doctor-nurse communication so that we've been able to integrate that quality of care and improve it at the bedside. We've been able to look at how new ideas and new thinking can help inspire our nurses, put in place programs within the unit to fine-tune the care that we're giving, and get all those ideas which everybody has locked in their head out on the table and really start to get things moving.
It's also broadened and given me a piece on the unit, part on the unit, so that they can come to me and ask me the questions.
Quite a bit, actually. I was not a very happy nurse when I first started here. A lot of circumstances that made me upset, and being involved has helped me feel like I had some control over my situation, and it's made me much, much happier in my workplace and with my patients and with my coworkers too.
I think there's been a lot of positive outcomes that have happened because of the process improvement teams, and you can see that by the data that's being collected and measured and presented.
Absolutely. I feel that it gives me more power to be a better nurse, to use the skills, use the information that I've received.
The process improvement meetings provide a wide range of opportunities as a new graduate nurse, especially in being in a residency program. It brings evidence-based practice and research that is up and coming.
It tells you the reasons behind using things, not just what to use. Because sometimes you'll see, oh, there are chairs. Because today they were showing chair that you can put on chairs, cushions. And before I'd be like, okay, it's a cushion for chairs. The chairs already have cushions. But now we know, like, it redistributes their weight. We can explain it to them.
It definitely helped me feel more empowered. If there's something, that I notice on the floor that I feel like needs attention, I now know that I could come to one of the process improvement meetings and I could, offer that suggestion.
I was able to see what goes into the process for the quality indicators and measures that we're trying to do. So it reinforced to me that the rationale behind why those are done and then how their changes are made to improve what's being done.
Just going to the meetings really kind of helps you focus on what's important in patient care, and then there's always new information, new evidence-based stuff that's brought up that's really great for and just improving patient care.
Process improvement committees will improve the care that I provide, just in the fact that you learn about what is evidence-based practice, what are the things that people are researching and implementing that are working well.
I really liked was the seat cushions. I know for me, like trying to get patients up in the bed, sometimes they get uncomfortable just sitting on there. So one of the things they brought today was a chair cushion, and I mean, I sat on it and I wanted to take one home. Like it was a sweet thing. So I think that there's just so much that's always brought to the table from different aspects.
I definitely appreciated seeing how many people attend the meetings. So I appreciated seeing who, all takes time out of their schedules to come and be part of these process improvement meetings. So it just seemed like it was a very productive atmosphere.
Paying attention to your patient's skin and nutritional status and how those two are correlated, I think really staying on top of it and seeking out resources as needed. And we talked about the supplementation with nutrition, which I think is really a big deal. So just that reinforcement was very important for patient care.
Looking at the different pain scales options and talking about education to patients about pain, and trying to help them realize, what a realistic goal for pain is, and to come up with a better way to address their pain.
I think that our overall goal is always care for the patient, and what I was able to see here today was the care for the whole patient, not just like our nursing cares, not just the physical cares, but the psychological and the emotional, the social aspect of it.
You actually are more invested in your nursing care because you can make the decisions, because people can just sit around and say, oh, I don't like this, or I don't know why this is working, so I'm not going to do it. But if you actually get a choice and if you can put in your own voice, it makes for a better workplace, in my opinion.
That means you're committed to the organization and you want to see that organization do the best that it can, which I think enhances everyone's work experience overall then, and it enhances employee satisfaction.
Process improvement is a place where you can bring your ideas that you have throughout the day and actually get them out there, because during a patient day you're just so busy and you notice little things that need worked on. You have suggestions, but it's hard to do anything about it during your shift because you're so focused on your patient care.
The process improvement goals, are established for a reason. So, learning behind what those, like I said earlier, the rationales for, why those specific measures are put into place, and then working to achieve them, takes, shows like pride in the organization and a commitment to making it the best that it can be.
I think people kind of wanting to improve healthcare and improve patient care, especially as nurses, I think that's huge for us. And so I think that improves your commitment to the hospital and to your job and to your patients as well, because you want to do what's best for them and get them well as quick as possible. And I think that that's what kind of process improvement is for.
I think a huge factor in healthcare and patient safety is communication. And with miscommunications comes misunderstandings, and it was very apparent during the meeting because we've got all these different people from different units and we have an hour to talk about each subject. And these subjects like fall risks, you think, how are you going to talk about all of this in an hour? And it takes the subject and it picks it. You pick it apart down into these things, and all these things surface that you didn't even realize you didn't know. And so it brings people from all these different areas and really gives you a better understanding, because problems really come from misunderstandings. So I think it would just help everybody kind of be on the same page to really talk about everything as in-depth as they do during those meetings.